We do know a lot about air pollution and its effects on children's health. That's really rapidly expanded in recent years. And children are what we consider a vulnerable group.
Children are at a higher risk during very smoky days.
So kids breathe more, they breathe faster, and they take in more, pollutant on a per kilogram basis compared to an adult. They also like to be active, and so that respiratory rate is reflecting on how active you are. So kids, they like to run around and increase their respiratory rate, so they're going to take in more in that case as well.
Dr. Karr says research has shown that air pollution may even pose a threat before birth.
Part of a child's growth and development starts in utero as a fetus. And we know, of course, there's a massive amount of growth happening then. And so exposures to the pregnant person, so they're breathing in air pollution, that can transfer to the fetus. What's been intriguing to me as an environmental epidemiologist and a pediatrician is this emerging evidence base around other outcomes like affecting birth outcomes like low birth weight or premature birth, as well as growing brains and manifesting as effects on learning and behavior in children.
So what should parents do on smoky days?
I think the most important thing I talk to patients about is being aware of your local air quality. So, there's easy ways to know kind of what your air quality is right now, where you live, as well as a little bit of a projection for what's expected in the next couple of days. So you can think about, do I need to make different decisions about where my kid's spending time and how active they are outdoors? The first thing to do on a bad air quality is just not to be outside. So going inside will reduce exposure. Going outside, closing doors and windows will reduce exposure, about 50% on average for most people. If you go inside, close the windows, shut the doors, and you have an air cleaner or a good filter on your furnace, you can go even further to reduce your exposure, about 80%. So, kind of being prepared and thinking about that.